Welcome to this edition of Research Connection. Joining me today is Dr. Kristen Messenger and Dr. Katie Tolbert. Thanks for joining me.
Yeah, thanks for having us.
Thank you for having us.
So tell us a little bit about yourselves.
I'll go first.
Yes.
My name is Kristen Messenger, and I am an assistant professor of pharmacology here at the College of Veterinary Medicine. I'm also an anesthesiologist here.
And I'm Dr. Katie Tolbert. I am a clinical veterinarian at NC State as well as a clinical associate professor at Texas A&M in the gastrointestinal laboratory, and I am a small animal internist.
And our lab here at the vet school focuses on the optimization of analgesic therapy in animals, and we study a variety of species and a variety of drugs, but non-steroidal anti-inflammatory drugs are one of our main areas of interest.
Yep, and I come along into this project because my clinical research interest is in the use of gastroprotectants and specifically acid suppressants such as Prilosec or omeprazole, and sort of the indications for use as well as the adverse effects associated with the use of omeprazole in dogs and cats.
And you guys are collaborating on a grant together. How did that come about?
That's right. We received a grant from the American Veterinary Medical Foundation to study the interactions of carprofen and omeprazole in dogs. So carprofen is a nonsteroidal anti-inflammatory drug that is commonly used as an analgesic for dogs with osteoarthritis. And then omeprazole is Katie's area of expertise.
That's right. So a lot of people understand that carprofen and other NSAIDs can cause gastrointestinal side effects, and also they worry about gastric ulceration with the use of NSAIDs, and so a lot of times people will co-prescribe omeprazole or Prilosec to try to mitigate some of these side effects, but we have some concerns that the co-administration of these two drugs could be problematic.
That's right. So we decided to go ahead and investigate that in our research beagle colony here. And we've been working with several really amazing veterinary students and postdoctoral scholars this summer to get this work done. And we've received some pretty neat results so far. So we're still analyzing all of our data, but we're finding some pretty interesting results with the combination of carprofen and omeprazole together, potentially causing some changes in these dogs.
So again, it's pretty common that veterinarians will co-prescribe non-steroidal anti-inflammatory drugs and omeprazole because of their concerns for the potential side effects of carprofen in dogs. And so because we're concerned that actually the co-administration of these drugs will cause side effects, we embarked on this study, and our hypothesis is really that the co-administration of omeprazole with carprofen will actually increase intestinal permeability, as well as potentially change the bacteria that are present in the GI tract and favor more pathogenic bacteria potentially, and so cause more problems to the dogs as a result of co-administration than the dogs would have had with carprofen alone.
Interesting. Is this specific to dogs, or is the dog the model and other animals also would be affected?
Great question.
Yeah, so that's a really great question. And the work that we're doing has a lot of translational relevance because non-steroidal anti-inflammatory drugs are used widely across the world for the treatment of pain and inflammation, whether that's acute pain or chronic pain. Our model is coming at it more from a chronic pain interest, so we are focused on dogs with osteoarthritis, but as we all know, osteoarthritis affects humans across the world, and people take NSAIDs for this disease.
And I think what's really amazing about this study, obviously we're veterinarians, and so we're really interested in the implications for veterinary medicine and the treatment of our canine patients, but this study hasn't been done in a really good relevant model for humans, and so it's been done in rats, for example, and in mice, and there's many reasons why that model may not be the best for humans. And so because the dog GI tract is pretty similar to what we see in the human, especially when we look at gastric pH and intestinal pH, for example, this is going to be really probably transformative as a model for humans as well.
Neat.
Yeah.
Well, thanks for sharing.
Yeah. Thanks so much for having
Thanks
us.
for having us.
Best of luck.
Thank you. All right, so here we are with our summer scholars. We have Susie Jones. Hi, Susie. Hi. Susie's a rising third year. And then over here we have Ann Geyer. Hi. And Ann is a rising second year veterinary student. And then over here we have Hiroko Inamoto. And Hiroko is a veterinarian who's doing a postdoctorate program in our laboratory.
That's great.
And they're over here working hard on the analysis of carprofen and canine plasma.
Well, thank you.
Thank you.